Most people think of a skin infection as something small, temporary, and easily ignored. An irritated bump, a pimple that becomes inflamed, or a boil that eventually drains and disappears. But beneath the surface of these common assumptions exists a more complex condition that often begins quietly and develops in a way that can surprise those who mistake it for something minor. A carbuncle is one of those conditions. At first glance, it may look like a cluster of inflamed pimples or a deeper, more painful boil, but what is happening beneath the skin tells a very different story. A carbuncle is not simply a surface irritation. It is a deeper bacterial infection that involves multiple hair follicles and spreads through the surrounding tissue, creating a network of pus-filled nodules that can become increasingly painful and inflamed over time. What makes it particularly important to understand is not just its appearance, but the way it develops internally, how bacteria move through layers of skin, how the immune system responds, and why certain areas of the body become more vulnerable than others. In many cases, carbuncles are misunderstood or dismissed early, which can allow them to progress into more severe infections that require medical intervention. Yet when identified early and understood properly, their progression can often be managed effectively with appropriate care. This video will break down exactly what a carbuncle is, how it forms beneath the skin, the biological mechanisms behind its symptoms, and the treatment approaches used in modern medicine. By the end, the condition will no longer feel like an abstract medical term, but a clearly understood process within the body's own skin defense system. Number 1, what a carbuncle actually is beneath the skin. A carbuncle is a deep bacterial infection that occurs when multiple hair follicles become infected at the same time, forming a connected cluster of pus-filled abscesses beneath the skin. Unlike a simple boil, which usually affects a single follicle, a carbuncle spreads across a broader area of tissue, creating a more complex and inflamed structure. On the surface, it may appear as a swollen, red, and painful lump, often with multiple points of drainage, but what is happening beneath the skin is far more extensive. The infection typically begins when bacteria, most commonly Staphylococcus aureus, enter through small breaks in the skin, such as minor cuts, friction points, or even areas weakened by shaving or sweating. Once inside, the bacteria multiply rapidly within the deeper layers of the skin, triggering an immune response that sends white blood cells to fight the infection. This immune activity leads to the accumulation of dead cells, bacteria, and fluid, forming the thick pus that characterizes a carbuncle. As the infection spreads across neighboring follicles, small abscesses merge into a larger interconnected mass, which is why carbuncles tend to be larger, deeper, and more painful than individual boils. This process is not superficial. It involves the dermis and subcutaneous tissue, where inflammation can affect surrounding blood vessels and connective structures. In real-world terms, this means a carbuncle is not something that simply sits on the skin surface. It is an active infection embedded within the tissue layers, evolving over time if not properly treated. Number 2, how bacterial infections begins and spreads. The development of a carbuncle begins at a microscopic level, often in a way that goes unnoticed. The skin, while being the body's first line of defense, is not completely impenetrable. Small disruptions such as microabrasions, clogged pores, or irritation from friction create entry points for bacteria that normally live harmlessly on the skin surface. When conditions become favorable, such as increased moisture, sweat accumulation, or weakened local immunity, bacteria like Staphylococcus aureus can penetrate deeper into hair follicles. Once inside, these bacteria begin to multiply in an environment that lacks the full protective barriers of the outer skin layer. The immune system responds quickly, sending white blood cells to contain the infection. But this defensive response also contributes to inflammation, swelling, and pus formation. In the case of a carbuncle, this process does not remain isolated. Instead, the infection spreads laterally from one follicle to neighboring follicles, creating a network of infected areas that eventually merge into a larger, more complex lesion. This spreading occurs because the bacteria and immune response are not confined to a singular follicular unit, but move through connective soft tissue spaces beneath the skin. As the infection expands, pressure builds within the tissue, leading to increased pain and sometimes spontaneous drainage through multiple openings. In daily life, this progression explains why a small, seemingly harmless bump can evolve into a significantly larger and more painful condition over several days. Number 3, why certain people are more prone to carbuncles. Carbuncles do not occur randomly. They tend to develop more frequently in individuals with specific risk factors that influence skin integrity and immune response. One of the most significant factors is the presence of conditions that affect blood sugar regulation, such as diabetes, which can impair the body's ability to fight infection effectively. Elevated glucose levels can weaken white blood cell function, making it easier for bacteria to establish and spread within the skin. Additionally, individuals with compromised immune systems are more susceptible because their bodies are less efficient at containing localized infections before they expand. Beyond internal health conditions, external factors also play a major role. Poor hygiene, excessive sweating, friction from tight clothing, and repeated skin irritation can all increase the likelihood of bacterial entry and follicle blockage. Even minor skin injuries that are not properly clean can become entry points for infection. On a deeper level, this susceptibility reflects how the skin's protective barrier is influenced by both internal biological balance and external environmental stress. When these factors align unfavorably, the skin becomes more vulnerable to bacterial colonization and deeper tissue infection. In real-world terms, this explains why carbuncles are more common in areas of the body where friction, moisture, and hair follicles are concentrated, such as the neck, back, thighs, and shoulders. Number 4, early symptoms and how a carbuncle begins to form. A carbuncle typically begins as a small, tender swelling beneath the skin that may resemble a pimple or early boil. At this early stage, the infection is still localized, but inflammation is already present within the deeper layers of the skin. As the immune system responds, the area becomes increasingly red, warm, and sensitive to touch. Over time, the swelling grows as more follicles become involved, and the tissue begins to harden due to ongoing inflammation and pus accumulation. Pain intensifies as pressure builds within the confined space of the skin layers. One of the distinguishing features of a developing carbuncle is the presence of multiple pus-filled heads that may eventually form and rupture, creating small drainage points. This is a sign that the infection is no longer limited to a single follicle, but has spread through adjacent tissue. On a deeper level, these symptoms reflect the body's attempt to contain and expel the infection while simultaneously managing tissue damage caused by both bacteria and immune response. In everyday experience, this stage is often when individuals realize the condition is more serious than a simple pimple or boil, as the size, pain, and persistence of the lesion increase noticeably over time. Number 5, the immune system's response inside a carbuncle. When a carbuncle forms, the immune system activates a complex defensive response designed to isolate and eliminate the bacterial infection. White blood cells, particularly neutrophils, are rapidly sent to the infected area through the bloodstream. These cells attack bacteria by engulfing and breaking them down. But in doing so, they also contribute to the accumulation of dead cells and fluid that forms pus. This buildup creates pressure within the tissue, which contributes to the swelling and pain associated with carbuncles. On a deeper level, this immune response is both protective and destructive. While it is essential for controlling bacterial spread, the intense inflammatory reaction can damage surrounding healthy tissue, especially when the infection is deep and widespread. This balance between defense and collateral damage is what makes carbuncles more severe than superficial infections. In practical terms, the body is actively fighting the infection, but the visible symptoms are a direct result of that internal battle. Number 6, why carbuncles are more serious than boils. Although carbuncles and boils are often grouped together, they differ significantly in severity and structure. A boil typically involves a single infected hair follicle, while a carbuncle involves multiple interconnected follicles and deeper tissue layers. This difference means that carbuncles tend to be larger, more painful, and slower to heal. On a biological level, the spread across multiple follicles creates a broader area of inflammation and increases the likelihood of systemic symptoms such as fever or fatigue in more severe cases. In real-world terms, this distinction is important because it determines how aggressively the condition should be managed and how closely it should be monitored. Number 7, common locations and why they matter. Carbuncles most commonly appear in areas of the body where hair follicles, friction, and moisture are more prevalent. These include the back of the neck, shoulders, thighs, and buttocks. These regions are more prone to bacterial buildup due to sweat retention and repeated mechanical stress from movement or clothing. On a deeper level, these conditions create an environment where bacteria can more easily penetrate the skin barrier and multiply within follicles. Understanding location is important because it helps identify patterns of recurrence and potential underlying contributing factors such as lifestyle, hygiene, or skin sensitivity. Number 8, medical diagnosis and what doctors look for. Diagnosis of a carbuncle is primarily clinical, meaning it is based on visual examination and physical assessment rather than complex testing. A healthcare provider evaluates size, depth, pain level, drainage presence, and surrounding inflammation. In some cases, a sample of the pus may be tested to identify the specific bacteria responsible, especially if infections are recurrent or severe. On a deeper level, diagnosis also involves assessing whether the infection has spread beyond the local area or shows signs of systemic involvement. This step is crucial for determining appropriate treatment. Number 9, prevention and long-term skin health. Preventing carbuncles involves reducing the conditions that allow bacterial infections to develop in the first place. This includes maintaining skin hygiene, avoiding prolonged moisture exposure, and minimizing friction in vulnerable areas. On a deeper level, prevention is about maintaining skin barrier integrity and supporting immune function through overall health. When these systems are balanced, the likelihood of deep follicular infections decreases significantly. A carbuncle is more than a skin infection. It is a layered biological process involving bacteria, immune response, and tissue structure interacting beneath the surface of the skin. While it may begin as something small and easily overlooked, it can evolve into a deeper and more complex condition when multiple follicles become involved. Understanding how it forms, how the body responds, and how treatment works transforms it from a vague medical term into a clearly defined process within the body's defense system. At its core, a carbuncle represents the balance between protection and inflammation, where the body is actively fighting an infection while also producing the visible symptoms of that battle. And when understood properly, it becomes clear that early awareness and appropriate care are the key factors that determine how that process resolves.